Hello, everybody. Welcome back to TruthMed. I am Dr. G. Thank you so much for spending a little time with me. Today, I had intended to do the video on alternative medicine that I talked about in my previous video, specifically the one on vitamins and herbal supplements. And I do still intend to do that video. In fact, all the research is done. It was very fun to do. And the good news is there are a lot of new trials that have come out, a lot of new studies, since the last time I did a deep dive on this topic a few years ago. And that's exciting because it means that not only is there more attention being paid to the topic, but it also means that we have more information to decide which herbal supplements actually work and which ones not so much. But in the meantime, I got a bit distracted because I had a bunch of questions come up from a variety of sources about the dreaded monkeypox. And I had a number of people in my community say, you should do a video on monkeypox because it's blowing up right now. Well, fair enough. It is blowing up right now, whereas alternative medicine will still be there in a week or two. So I decided to take their advice. And today's topic, it will be everything that you need to know about monkeypox. So first of all, what is monkeypox? I mean, I'm sure some of you are probably thinking, monkeypox, really? This is what we're dealing with now? Could it get any weirder? Did you medicine people just make this one up? Well, unfortunately, no, we didn't make it up. It's been around for decades, actually. It's just that it's been, for the most part, isolated to Africa, and we haven't seen a whole lot of it in the US. There was a small outbreak in 2003, I think about 47 cases, although at that time, the cases were all in people who had had exposure to prairie dogs. That's where they contracted the virus. So there wasn't a lot of person-to-person spread, and the outbreak kind of petered out. So it wasn't a big deal, and we haven't seen much of it since then until the current outbreak. So where did this all start? Well, monkeypox is in a family of viruses known as the orthopox virus family, and it includes such members as smallpox, vaccinia, cowpox, and of course, monkeypox. These are DNA viruses with a relatively stable genome, which means that they don't mutate very much, unlike, for example, COVID, which we've been dealing with over the past couple of years, which is a fairly fast mutator. Although even COVID has nothing on things like HIV and hepatitis C, which are crazy fast mutators, which, by the way, is why finding a vaccine for hepatitis C and HIV has been so difficult. But anyway, coming back to monkeypox, it was first discovered in lab monkeys in 1958, hence the name, and it stayed put in monkeys for a while, but in 1970 we had our first human case. And from that point forward, it popped up every now and then in Africa. Somebody would come up with a case of monkeypox, but it wasn't really a big deal. To give you an idea, between 1970 and 1980, there were only 60 reported cases of monkeypox, and they were all in Africa and people who had had exposure to wildlife in Africa. So, it really didn't make much of a big splash. But then something interesting happened. In 1977, we had just eradicated smallpox off of the face of the earth with the world's most successful vaccine campaign. Now, once we had done so, we of course stopped giving the smallpox vaccine, because why give somebody a vaccine for something that doesn't exist anymore, right? Well, sometimes there is a reason. Monkeypox is related to smallpox, so if you get the smallpox vaccine, you are somewhat protected against monkeypox as well. And so the World Health Organization at the time was a little bit concerned that if we stopped giving the smallpox vaccine, we would see a rise in monkeypox cases. Were they correct? Yes, they were. We went from having 60 cases in a decade to having 760 cases in just 2 years, according to a study from 2005 to 2007. That's a 20-fold increase. But having said that, even then, it still was a relatively small player, and it's remained endemic to parts of Africa until the current outbreak. So why is it such a big deal now? Well, there probably are a few reasons, but the biggest is that even though monkeypox is a fairly stable virus that doesn't mutate a whole lot, it still can cough up a new variant every once in a while. Up until now, there have been two main variants, a Central African variant and a Western African variant. But all of a sudden now there's a new clade. By the way, clade is just a fancy medical term that means a variant or a subspecies of virus. There's a whole bunch of different terms, lineage clade, variant, subspecies. They all have subtle differences in their definition, but for our purposes, they pretty much all mean the same thing. Anyway, there's a new clade now, and this one has some important differences. The good news is that it has seemingly a lower mortality rate. In fact, the mortality rate is down around 1% thus far. That's much better than the 10% that we see in the Central African variant. But The bad news is it seems to hop from person to person much more easily. In other words, it's much more contagious, and that's why we're seeing many more cases now, whereas we didn't before. Now it's spreading really fast. We're up to about 8,000 cases in the US so far, and in fact, it quintupled, went up 5 times in a span of just 2 weeks. That's really fast spread, so it's worth knowing about because it will be coming to a place near you soon. Which leads us to how we recognize the monkeypox. What is a pox anyway? A pox on both your houses. A pox, in medical terms, just basically means a virus that causes a rash, and in particular, a very specific type of rash. It is called a maculopapulovesicular rash. Say that 3 times fast. I'm going to call it MPV for short. The MPV rash starts as a macule. What's that, you say? A macule is a discolored area of skin with a rash, but it doesn't have any raised features to it. There's no bump. It's flat. You can run your finger across it and not feel anything. If you want to get really technical with your medical terminology, a macule is a discolored area that is 1 centimeter in size or less. If it's bigger than that, it's called a patch. But over a few days, that macule will progress into a papule. Now, it does have a bump. It does have texture. You can feel it now. And again, if it's less than 1 centimeter, it's called a papule. If it's bigger than that, it's called a nodule. Then, as it continues to evolve, it becomes fluid-filled. Now it's called a vesicle, or if it's big, it's called a bulla. Bulla, bulla, bulla. It's kind of fun to say. Anyway, that's an MPV rash, maculopapulovesicular rash. Starts off flat, then it becomes a bump, then it becomes a fluid-filled bump, a vesicle, and then it will break open and it will spill that fluid out onto the skin. And that's when people are at their most contagious. They've got all those viral particles and all that fluid on top of their skin. They're very contagious at that point. But eventually that will scab over and start to heal. And at that point, a person is no longer contagious. If this is sounding a little familiar to you, it's probably because you are old like me and you are thinking of chickenpox. Chickenpox causes a rash that is very similar to the monkeypox rash. And indeed, the two can be mistaken for each other all the time. They both cause intense muscle aches and joint pain and headaches, and they cause high fevers. And so they share a lot of similar features. Chickenpox has become much more rare. Why? Because of a vaccine. But there are still some chickenpox cases floating around out there. So how do you know the difference? Well, if you really want to know the difference, you got to do some blood work. But there are a couple of clinical clues that you can latch onto. The symptoms are, for the most part, very similar between the two, but monkeypox will cause lymphadenopathy. Lymphadenopathy is just a fancy word for swollen lymph nodes, and you particularly see those in the neck, in the armpits, and in the groin. So you've got big inflamed, painful bumps in those areas. That's lymphadenopathy. And you see that in monkeypox, whereas you generally don't see that in chickenpox. That's one clue. The other one is that in chickenpox, the rash is in all different stages at the same time. Some of the lesions are macular, flat. Some of them are papular, bumpy. Some of them are vesicles, fluid-filled. Some of them are broken open, all at the same time. Whereas in monkeypox, the lesions advance together, so they're all in the same stage at the same time. And that's another way that you can tell the two apart. So that is what monkeypox looks like, and that's what it does. But the thing that we really worry about with monkeypox is not the rash and the fever and the pain. That all sucks. But what we really worry about are the severe complications, and those are mainly, number one, it can cause a pneumonia, infection in the lungs. Number two, encephalitis, infection in the central nervous system, the brain. And number three, it can cause sepsis. And when these things happen, that's when people get seriously ill, and that's where we worry about people dying. Again, it carries a mortality rate, this current variant, of about 1%. Now, how do we acquire monkeypox? Because if we know how to acquire it, we know how to avoid acquiring it, right? Well, the good news here is that monkeypox is not COVID part 2. COVID is a very good respiratory spreader. It spreads via respiratory droplets and even via aerosols to some extent. Monkeypox can spread through respiratory droplets, but it isn't very good at it. And the CDC currently estimates that you have to have fairly prolonged contact, like we're talking maybe even a few hours, to acquire monkeypox through the respiratory route. It's just not very good at it. Doesn't mean that you can completely ignore it, but you don't need to worry too much about it. On the other hand, monkeypox spreads very well via the contact method. And those of you who watched my earlier videos on COVID will remember the various methods of viral spreading contact method is spread via touch, right? And that can be direct touch, like I give you a hug or a kiss or a handshake. And it's worth noting that the MPV rash of monkeypox is sometimes present on the palms of the hands and the soles of the feet. That's very unusual. Most rashes do not show up on the palms and the soles, but monkeypox does, so it can be spread that way. But it can also be spread through indirect touch. So, for example, I dry off using a towel, and then you dry off using the same towel, and I had monkeypox with the rash. I probably just gave it to you. Okay, so it spreads really well via the contact method. And of course, what is the thing that we do that involves the most contact? Sexual contact, right? There's a whole lot of touching going on, not to mention exchange of bodily fluids. So sexual contact has been the predominant form of spread through the outbreak thus far. And in particular, if you happen to be a man who has sex with men, and particular if you have unprotected sex, and in particular, if you have sex with multiple partners, you are at particular risk. You need to be very careful. So that's what you need to look out for. So if you see a person who looks like they're covered with a million mosquito bites, maybe those aren't mosquito bites. Maybe that's that MPV rash of monkeypox, and you need to be careful. The last thing we're going to talk about is treatment. Now, I'm not going to spend a whole lot of time on treatment because there aren't a lot of great treatments for monkeypox. The best treatment for monkeypox is don't get monkeypox. An ounce of prevention is worth a pound of cure, right? There are two medications. One's called tecovirimat and the other is called cidofovir. Both are antiviral therapies that specifically target orthopox viruses, but they're still relatively experimental and they're being distributed from the CDC directly as of now. So it's not something you can pick up at your local pharmacy or get at your local hospital. If you are sick with monkeypox, I mean really sick, and you're worried, gosh, may I be one of the people who is going to die from this? Well, then you should go to the hospital where a doctor can contact the CDC and potentially you could receive those medications. But it's difficult to get them, and just how effective they are has yet to be determined. Prevention is really the key. And we've already talked, for the most part, just avoid those scenarios where you would get monkeypox. That's the best way. But there is also the vaccines. There are two vaccines for monkeypox. The first one is actually the smallpox vaccine. Now, this one is not ideal to use for a number of reasons that I'm not going to go into. And don't get me wrong, if we had a bioterrorism attack of smallpox, for heaven's sake, we would be very, very glad that the government has stored up huge stockpiles of the smallpox vaccine, which it has. But otherwise, it's not really one that we want to use if we don't have to. But there is a newer vaccine that is called Jynneos, and it is a better option for people who are at high risk to get monkeypox or who have been exposed to monkeypox. So, who are the people? And right now, the CDC is doing a targeted vaccine campaign. They're not giving the vaccine to everybody because probably everybody doesn't need it. At least we sure hope not. If this spreads much more, like if it spreads wildly, then gosh, we may be looking at having to vaccinate everybody, but probably not. Probably a targeted vaccine campaign will work. And who are they targeting? Well, if you're a man who has sex with men, particularly unprotected, particularly multiple partners, you're definitely high risk. And you should look into getting the vaccine. Other people would be anyone who thinks they have been exposed to monkeypox. Obviously, you are at high risk. And then certain lab workers or medical personnel who are likely to be exposed either for testing for or treating monkeypox can be considered high risk too, and they can be vaccinated as well. So those are the people that they're rolling it out to right now, but that could change, so stay tuned. All right, everybody, that's about it for monkeypox. If you have any questions at all, please leave them in the comments below and I'd be very happy to answer them. And if you found this in any way helpful at all, please consider liking the video, subscribing, or sharing with your friends and family. I would very much appreciate it. But in the meantime, every day out there, find a way to make the world a better place. Okay? Thanks, guys. Bye.